Emily. How are you doing today?
Good, how are you?
Good. My name is Brooke. I'm just going to go over some dietary analysis with you.
Okay.
It's where we kind of assess your oral cavity and what you eat at home and kind of go through that and see what your habits are so we can see how to treat you. I'm just going to go over your dietary analysis. It looks like you did a full 5 days, so thank you for participating in that 5-day analysis.
Yeah.
It gives me a good insight on what you eat at home and what kind of things are sugary and that could affect your caries process or your cavities. So your first day you did pretty good with the calorie content and everything because you were getting to your nutrients and everything, so you weren't deficient, but you did have a high sugar score, so that puts you at a higher caries risk by eating some of those sugary things. And those days it was a lot of just hidden sugars in your foods. It wasn't anything that you would expect to be sugary. So sometimes we just gotta kind of watch out for those as well. And foods that stick to our teeth, or like carbohydrates, those can really cause a big differences with that as well. The next few days you were pretty low to moderate on your sugar scores, even though you did have some sugary things. The last few days you were moderate to high, and I noticed that you had a couple cups of coffee with creamer, and a lot of times our creamers can contain a lot of sugar in there, so that's something to be aware of. And then it looks like you like to drink Coke, because you had Coke twice that day, in one day, whatever, once a vanilla Coke and the other time a Diet Coke. And as you know, canned sodas and stuff like that can contain a lot of sugar in there as well. A lot of the other things you were just eating were fairly good for you and full of nutrients, just a lot of hidden sugars. So we're just going to kind of go over that and explain to you how your caries process works and what your risk is and all that kind of stuff. So first of all, your caries classification, after looking at your x-rays and going through your chart, you have a class 1 caries, which is the cavities that are right on the top surface of your teeth, usually in the posterior teeth, back in the molar area. And those ones are very common because we have food that gets kind of stuck in those pits down deep into our cavities of our tooth. And that can cause decay if those kind of sit there. So we got to make sure we're brushing fairly well on the tops of our teeth to get those as well. Otherwise, the rest of these are different types of cavities that we can have between our teeth, near the gum line, and then obviously these ones are some more bigger ones between the teeth and stuff like that. But we didn't see anything for those for you, so it goes to show you're probably doing pretty good at flossing and stuff like that. So that's always a good thing. Cavities are caused by 4 components. I was going to go over that with you just so we can kind of get a better idea of what that looks like. So the 4 components that causes a cavity, first of all, starts off with the microorganisms or bacteria that sits on your teeth from eating those sugary foods and drinks and stuff like that. We can cause that bacteria to create an acid. So that's the second thing, is having a cariogenic diet. If you have those sugary foods and drinks that sit on your teeth, it takes your mouth about 20 to 30 minutes for your pH to balance back out. By doing that, you need to have saliva. So that's what's really important as well. If you don't have a great saliva flow, like if you're taking medications that reduce salivary flow, which I noticed you are, that sometimes can be a component in caries as well, because if you don't have as much saliva in your mouth to regulate that pH, the acid formed from the bacteria and the sugary foods and drinks has a longer time to sit on your teeth rather than getting washed away and balanced by that saliva. So that's something to be aware of as well. And if there's something that you're struggling with is dry mouth, then we can make sure we are handling that as well. And then the last component is tooth resistance. And that's just your tooth structure and enamel, and see if it's strong enough to resist that bacteria and acid attack on your teeth. So those are the 4 components. Do you have any questions about that?
No.
This page is just a little tidbit of what I just said, is a more like simplified picture of it. So if we have those bacteria and germs sitting on the plaque and from our food and stuff, we could add that with our food and drinks that are sugary. It forms an acid, which is this little representation right here. And you put that on a healthy tooth and it causes a cavity. So that's why we just kind of want to know what you're eating at home and how many sugars you are consuming and stuff like that, because we want to make sure that we're trying to prevent those cavities and stuff. Because once you have a cavity, it doesn't just go away. You got to get it fixed, and then getting dental work is not any fun. So I was looking at your dietary analysis, and I noticed that you had those class 1 caries, which are just on the tops of your teeth, and that you had the creamer in your coffees and the Coke that you had. So those are the main 3 things I'm going to talk about, is just that you had already some previous caries that you've had restored, and then the things you're kind of eating right now. Also looking at your chart, it shows that you have a periodontal class of 1, which means you have no bone loss, so you're doing really well. And periodontal disease is a different type of bacteria that can be in your mouth and cause further problems. The periodontal disease process starts with gingivitis, where your gums will be kind of inflamed and red, and then if you have the bacteria that causes periodontal disease, it can actually progress to bone loss and recession, and a lot of times we'll end up having people end up losing their teeth. That's usually if you're not taking good care of them at home and stuff like that. And seeing a regular dentist every 6 months is important as well for prevention of that. But not to worry about that now, just because you have no signs of it, so that's good. So some tips for reducing the bacteria and acid-forming materials in your mouth that can cause those cavities is that we should rinse with water after having something sugary or sticky, including pastas, because those are carbohydrates and those can kind of stick to our teeth. White bread is also very acidic, and those types of food as well you wouldn't think would have lots of sugars, but once we start to chew them up and spit them and sit in our saliva, they cause the sugars. So we would like to rinse those out. So just rinsing with water after you have those coffee drinks or Coke, that's super important. And then also when you do have those types of beverages, if you choose to, just to not drink them throughout the day. So don't just sip on them throughout the day or throughout a couple hours. Try to have them in one sitting rather than throughout the day any more frequently, because like I said, it takes about 20 to 30 minutes for your pH levels to balance back out with your saliva. And if you take a sip and then only wait like 10-15 minutes and take another sip, your mouth never actually returns back to its normal pH levels, and it kind of goes through that acid attack constantly throughout the day, so your enamel is weakened and has more capability of causing those cavities. And then also just eating some more like bacteria reducing foods, which is, believe it or not, low-fat cheese. Cheeses seem kind of sticky, but those are really good at reducing that. Raw vegetables and crunchy fruits, and those can actually be really good because they'll also remove the plaque and debris that's sitting on your teeth from other food throughout the day. And then nuts and popcorns and stuff like that that are kind of more crunchy and good for your teeth and cleaning them off and stuff like that. So that's the tips for reducing. Do you have any goals for yourself for next time after doing your 5-day analysis, or anything that you notice that you need to work on?
I mean, I probably should cut back on my coffee and pop intake, but it's what I'm doing to stay awake right now.
Oh, and that's totally understandable.
So I guess maybe I could try like drinking more water throughout the day with those other drinks, and then maybe choosing like better snacks like apples or carrots or something.
Yeah, and I did notice that when I was looking at your dietary analysis, there wasn't a whole lot of snacks between meals, which is really good if you're not like constantly snacking, especially when they're not the sugary type snacks. But some of them that you did choose to eat were like chips and crackers and stuff like that, and those can be kind of sugary and cause decay as well, just because they have those components in it. Not saying that those are bad for you by any means. That's kind of crunchy, and it will take the plaque off too. The chips will, but they're not exactly the greatest snack choice. So choosing those raw fruits and vegetables would be a much better option. So yes, looks like everything's going great, and I'm glad that you are making some goals for yourself after doing this process. I was glad to get to talk to you about all this. Hope to see you soon, and we'll see what happens with the next time.